Good morning/afternoon, everyone. Today we're going to explore the complex world of substance use disorders, focusing on their impact, scope, and the many challenges they present. This presentation will delve into the societal, economic, and health dimensions of these disorders, helping us understand why addressing them is so crucial for both individuals and communities. I'm excited to take you through this important topic and shed light on the various aspects that make substance use disorders a pressing issue. Here, we're looking at substance use disorders, or SUDs, which are much more than just a health issue. They represent a complex challenge that affects individuals deeply as well as society as a whole. People struggling with SUDs face misuse or addiction to alcohol and drugs, and this isn't just a personal battle, it has wide-reaching consequences. Despite the stigma and many misconceptions that still exist, it's important to recognize that these disorders lead to over 3.5 million deaths worldwide every year. Beyond the numbers, the impact on health, families, and communities is profound. Understanding SUDs is crucial if we want to provide better support and reduce the harm they cause on multiple levels. On this slide, we see a comprehensive breakdown of the economic and health costs associated with substance use disorders in the U.S. Substance use places a heavy burden on state budgets, consuming over 15% of allocated funds. Annual spending directly related to substance misuse reaches an astonishing $467 billion, which includes healthcare expenses that make up about 20% of that total. Law enforcement and criminal justice systems also absorb significant costs, estimated at $50 billion, while productivity loss adds another $100 billion to the economic impact. Shifting to health-related consequences, nearly 40% of hospital admissions are connected to substance use, and emergency room visits number around 1 million each year. Tragically, drug overdose deaths exceed 47,000 annually, contributing to a broader figure of approximately 12 million drug and alcohol-related deaths overall. This data vividly illustrates how substance use disorders strain not only financial resources, but also public health systems, highlighting the urgent need for effective prevention and treatment efforts. Here we see some striking statistics that reveal just how widespread psychoactive substance use is around the world and specifically in the US globally. At least half of the population has used psychoactive substances at some point, and the number of people using illicit drugs increased by 22% from 2010 to 2020, reaching about 275 million. It's also important to note that approximately 1 in 10 people will meet the criteria for addiction during their lifetime, which underscores the significant impact on public health. Zooming in on the US, the numbers are equally concerning. Around 163 million people aged 12 and older use substances like tobacco, alcohol, cannabis, or illicit drugs on at least a monthly basis. Breaking that down, nearly 52 million people use tobacco, 139 million consume alcohol yearly, and almost 50 million use cannabis annually. These figures highlight the scale of substance use and the associated challenges we face in terms of prevention, treatment, and policy efforts. Overall, this data paints a clear picture of the extensive reach of substance use disorders and the urgent need for comprehensive strategies to address them. Here, we're looking at the full range of alcohol use, from casual drinking to severe alcohol use disorder, or AUD worldwide. About 300 million adults are affected by AUD, and nearly half of these cases are classified as severe. One key risk factor is binge drinking, typically defined as having 6 or more drinks in one sitting, which greatly increases the likelihood of developing serious problems. Interestingly, during the recent global pandemic, many people actually increased their alcohol consumption. It's also important to note that men are far more likely to suffer from AUD than women, with rates about 5 times higher. The image on the right shows social drinking, which is common and often seen as harmless, but it can sometimes hide more serious underlying issues. Understanding this continuum helps us grasp how alcohol use can shift from normal social behavior to a critical health concern. Here, we focus on opioid misuse and opioid use disorder by first understanding the types of opioids involved. Opioids include heroin, which is illegal, but also a wide range of narcotic pain relievers that are either natural or synthetic. Over the past decade, misuse of these substances has doubled worldwide, with about 1.2% of the global population using opioids non-medically. In North America, this rate is even higher, at 3.6%. A major concern is prescription opioid misuse. Millions of people misuse these medications, which is made worse by the diversion of prescription drugs, meaning these medications end up in the hands of people they weren't prescribed for. This issue is deeply connected to the rising rates of overdose deaths. The image on the left helps to visually tie together the use of prescription opioids and illicit heroin, highlighting the broad scope and interconnected nature of opioid misuse today. Here we're looking at the scale of stimulant and cocaine use disorders. Globally, about 27 million people use amphetamine-type stimulants, and among them, 3.2 million have been diagnosed with a stimulant use disorder. This includes 1.5 million individuals who specifically struggle with methamphetamine use disorder, highlighting the widespread nature of this issue. Focusing on the US, around 5.2 million people use cocaine each year, and 1.3 million meet the criteria for cocaine use disorder. These numbers show how significant cocaine use remains in the country. It's important to remember that prescription stimulants also play a role here, as they are frequently diverted to illicit markets, which adds another layer of complexity when addressing these disorders. Overall, this slide emphasizes both the global and national impact of stimulant-related challenges. Here, we're looking at the widespread use of cannabis both globally and within the United States. Around 200 million people across the world use cannabis each year, making it one of the most commonly consumed substances after alcohol and tobacco. In the US, nearly 50 million people use cannabis annually, and importantly, over 14 million of these individuals experience some form of cannabis use disorder. Despite cannabis being illegal for recreational use in many countries, there's a growing push to legalize or decriminalize it for both medical and recreational reasons. This shift often leads people to believe that cannabis is completely safe or risk-free. However, the reality is quite different. Cannabis use disorder is a serious concern, affecting millions and showing that addiction risks are very real. The image here helps underscore the global scale of cannabis use while reminding us to consider its social and legal complexities. Understanding these points is crucial as we look at cannabis not just as a widespread substance, but also as one with significant health and societal implications. Here, we're looking at two critical areas: hallucinogens and designer drugs. Hallucinogens are a diverse group of substances, and one of the main challenges is how to classify them. For example, MDMA is tricky because it shares properties with both hallucinogens and stimulants, which blurs the lines between categories. Additionally, new psychoactive substances keep appearing, making it even harder to have clear definitions or consistent classifications. On the other hand, designer drugs are chemically engineered in secret labs, often specifically to bypass legal restrictions. The biggest concern with these drugs is that their health risks are largely unknown. This uncertainty can lead to serious, even fatal consequences. Overall, understanding these substances highlights the complexities and ongoing challenges we face in addressing substance use and ensuring safety. Tobacco use remains one of the most pressing global health challenges, responsible for around 8 million deaths every year. While tobacco products are legally available to adults, the addiction they cause leads to enormous health problems and economic costs. For instance, in the United States alone, smoking-related medical care costs about $170 billion annually. To combat this, public health initiatives like raising the legal age for purchasing tobacco are making a difference. These efforts have contributed to a notable decline in tobacco use worldwide, dropping from nearly one-third of adults in 2000 to just over 22% in 2020. This clearly shows the impact of sustained prevention measures and highlights why it's critical to keep pushing for policies that reduce tobacco use and its harmful consequences.